Hello and welcome to the Davos Dialogue event, the Davos Lab, hosted by the Global Shapers Thessaloniki Hub. We are so lucky to have two wonderful guests joining us, Olga Tarantopoulou and Jordyn Feingold, whom we will let introduce themselves in a minute. Today, we are going to focus on the theme of mental health. And to give some more context to our conversation today, let's start with the statistic that 1 in 4 people in the world will be affected by a mental disorder at some point in their lives. In addition to this, now the COVID-19 crisis has triggered a wave of global panic that has transformed our social and economic realities and put into question what our lives will look like in the near future. As many cope with uncertainty, loss, grief, and isolation, we need to reimagine mental health support systems to ensure people get proper help and so we can overcome today's mental health crisis. To start us off, Jordyn, could you give us a small introduction to your background that informs your ideas about mental health and tell us what does mental health mean to you?
Absolutely. Thank you so much for having me today. It's a delight to be here with you. So I am currently a fourth-year medical student in the US. I am about to graduate and get my degree. And before coming to medical school, I got my master's degree in something called applied positive psychology, which is the science of well-being and human flourishing. And in the practice of medicine, I'm going into the field of psychiatry, which is about really treating mental health disorders and mental illness. So I'm very interested in combining these ways of thinking, both looking at the positive side of the human experience and human flourishing, and also treating mental illness and that which afflicts the human mind and the human brain. So I think that perspective informs the way I think of mental health, which involves the proper treatment and support around mental illnesses. So things like major depressive disorder, generalized anxiety disorder, post-traumatic stress disorder, and the like. And also having structures and supports in place to, once we treat those things, and in order to treat those things, promoting well-being, which is about positive relationships, engagement in life, meaning in work, and a larger sense of purpose, vitality, having the vigor to do our day-to-day tasks with vigor, a sense of accomplishment, and experiencing positive emotions as well. So it's about the both dimensions, treating mental illness and promoting well-being.
Great, thank you, Jordyn. Now, Olga, can you give us a small intro for your background and inform your ideas about mental health and tell us what mental health is for you?
Yes, sure. So first of all, also thanks from my side for making this happen. I'm really excited to be here. I did my psychology diploma in Thessaloniki at the Aristotle University, and then I was also very much interested in positive psychology. I was thinking of going to the US, but then I decided that probably what I would like to focus on is more how you can use positive psychology in education in the, let's say, educational system on the political level. And I started my master's, which is an Erasmus Mundus master's called Euroculture. And it's focusing on society, politics, and history and cultures all over the world, basically. And I had the chance to study in several countries, and it's very interesting. So it's very interdisciplinary as well. Trying to keep my tracks with psychology still active in this wide field, but yeah, so that's about the background. And regarding my definition of mental health, first of all, after what Jordyn said, it's difficult to add something. It sounds very close to what I would define it. Maybe a point which I really like to highlight is that for me, it's not really only always about mental and physical health. I prefer to see it as a more holistic approach of an overall health, and always stressing this connection between body and mind, which we, I think, really have to get closer in order to be able to, stay in shape, stay happy, be healthy in an overall, yeah, maybe that should be it.
This body mind that you are referring to, it's very important, and many people have spoken about it, and it's very important for all, I think. Now let's turn over to my colleague Emily and ask the next question for Jordyn.
Yes, thank you very much, Marina. And it's so great, Olga, that you mentioned this mind-body connection, because that actually leads perfectly into the next question that we want to discuss, which is, how is mental health similar or different to physical health? How are they related? Should we look at them as two different things? Should we look at them as, the same thing, as being unable to separate them? I think that there's so many different perspectives on this question. And maybe Olga, we could start with you this time, since you just mentioned about the connection, and then we can turn to and hear from Jordyn.
Yeah, sure. So probably I also already peeked into the second question, but yeah, as I said, I mean, we are very much used to, with the confessional medicine we just had in the last centuries, to focus on either the mind or the body. And of course, we can see throughout history that there are a lot of religions and also spiritual paths which do not make any difference between those two. And still today, I think it's one of the still strongest dysfunctional beliefs we follow in our Western societies, to always try to figure out, okay, how can we diagnose it? What do we measure? And this psychosomatic connection really loses focus. And I think this is something which also, of course, triggers so much more depression, anxiety, everything which comes up in our time today. So yeah, I think for me, I'd say they are more one than separate parts of our health.
Totally. Yeah. And I really liked how you said that it's one of our main dysfunctional beliefs, that these things are two completely separate, distinct pieces, instead of looking at it from a more holistic perspective. And I think it's interesting that you mentioned also that it could potentially, having this distinction could be leading to more disorders as well, which was something that I hadn't considered before, and really, really interesting. So thanks for that comment. And Jordyn, I would love to hear you chime in on this topic as well.
So Olga, what you're saying is so true, and it's music to my ears, because this is one of the areas of focus that I'm going to be having in the field of psychiatry, is actually treating patients who have disorders of what we call gut-brain interaction, which were formerly called functional disorders. So everything that Olga's talking about, these centuries of parsing the mind and body, really can be dated back to the 17th century and Descartes, who proposed mind-body dualism. And the reason that this was so significant in the field of medicine was because it meant now that bodies could be dissected without any consequence for the human soul. So by saying that the mind is one entity and the body is something entirely different, that meant we could start doing surgeries and looking at the human body under a microscope and really dissecting the body with no consequence for the soul in the afterlife. So that led to an incredible amount of inability to really look at the human body and understand disease from a visible perspective. So looking at cells that are abnormal, really the classically physical health things. And then as society and technology developed, then that gave rise to things like x-rays and imaging tests. So that gap between what we can see physically and what exists in the mind furthered and has isolated that which we cannot see in the body, that which we cannot physically visualize yet, as something that many people don't see as legitimate or real. So take every psychiatric disorder that we have. We don't yet have great biomarkers. We don't have any imaging tests that could localize in the brain where your depression is coming from, where your anxiety is coming from. And in the area that I'm focused on is there are dozens of digestive disorders, patients who are living with chronic abdominal pain and who are very limited and impaired in a chronic basis. But there's nothing that we see on endoscopy or imaging tests or blood work that tells us what's going on. And these patients in our healthcare system are quite stigmatized because our physicians are not learned how to treat. We're not learned how to treat the mind and the body together. So I absolutely think there's so much more overlap than there is discrepancy. But when it comes to diagnosing a lot of the mental illnesses, we just don't have good, it's all symptom based. There's nothing that seems, we could say, yep, you absolutely have this subtype of depression because of what we see in your body. So all of that is just a little historical background, and to say that our systems really treat these things very differently. They're quite one and the same. If you've ever heard of the placebo effect, just this idea that there are profound physiologic changes that happen when our mind believes something to be true, and we anticipate that a medication is going to help us. And in medicine, we're always comparing our treatments against placebo. It's like saying, okay, what is the real effect of this treatment? But what we really should be doing is understanding how we harness the power of the placebo effect to improve patients' conditions, because that is just as quote unquote real as the effects of many of the medications we use in healthcare.
Amazing. That's really, really interesting. I've never actually heard it put that way before, of this question of how can we actually harness the placebo effect? Like, how can we use this power of the human mind or the power of the belief to help with these kinds of issues. So it's really interesting. And I want to circle back to one of the comments that you made about stigma, and how these kinds of chronic disorders that don't have physical biomarkers can be heavily stigmatized. I assume you mean like people might say, oh, they must be faking it, or maybe it's not real, or these kinds of comments. And if we can just talk a little bit more about stigma and how comfortable you feel openly talking about mental health in your household or community, or how you would go about telling someone if you were experiencing a crisis or to start therapy. Maybe you can talk a little bit about that side of the stigma in your personal experience. And then I want to hear from Olga as well.
Sure. So there's a lot of stigma around mental health, and really in all these digestive disorders that have the experience of illness without the visible disease. So a lot of patients who suffer from these things and suffer from psychiatric disorders, there's, by even healthcare professionals, but then society more broadly, there's this notion that this is all in your head. If you were just stronger or cared about yourself, you wouldn't feel this way. This is brought upon you, you're weak. And those things couldn't be further from the truth if we really understand mental illness as a biological process, which it is. Of course, it's informed by the environment as well. And I think stigma and fear of being perceived as weak is a reason that many people don't seek treatment. And stigma can be internalized, so we feel this ourselves, but it could also be perceived by others, and it very much experienced, and people can be treated differently, even by loved ones and family members, for the notion that they are experiencing a mental illness. So stigma is a real driver. It's very powerful, and it's been studied. We know that it exists related to mental illness. Even there's stigma around just being prescribed antidepressant medications. And so these are very loaded concepts. And because of this mind-body dualism in society, it's taken a lot longer for mental health diagnoses to be seen as legitimate compared to physical. Like, we would never judge someone for having high blood pressure, or, oh, you're so weak, you have diabetes. Like, how dare you be born with, for type 2 diabetes, there might be some judgment and stigma, but, we would never fault someone for being born with a genetic illness, for example. So, it's very tough, and it's so culturally dependent. So I grew up in a family where going to therapy was totally normalized, and my parents have been in therapy before, and the idea of, if you need help, we're going to get you that help, was absolutely accessible to me growing up. I have friends who live in households where they don't even believe that mental illness is real. So the idea of going to therapy was not something they never occurred to them until learning about it in medical school, for example. So I think there's a huge spectrum of the way we believe these things to be acceptable, and that really dictates our ability to get help and seek support. I think sometimes if it's not accessible to us in our families, and someone is sitting with a mental illness or feeling like something's not quite right, finding another adult or peer in the network, whether it's a professor or a guidance counselor in school, to talk about these issues with, and getting some help figuring out what that next level of care is really important for people who don't have that immediately in their family network.
Yeah, I think you bring up a really, really interesting point about how, these kinds of norms operate at so many different levels, at the family level, at the community level, at the cultural level, at the national level. I mean, there's so many layers where you can either find more acceptance for these kinds of things or find more stigma that kind of all interact with one another. So Olga, would you also care to respond to this question about, what your experience with stigma has been, how comfortable you would feel speaking about this in your household or in your community, or how you would tell someone if you were experiencing some kind of, mental health crisis or desire to go to therapy?
Yeah, sure. So what I have been I've been trying to compare all those countries I were living in the last months and years, and I was always like, I really want to see whether it's true that maybe the Mediterranean countries are sticking more to those taboos and stereotypes, which clearly all those fears are made of, and had the time to build on in decades and decades, or whether, maybe in Sweden people really are so openly talking about it, and also the difference it means in the US, for example, to go to a counselor and a therapist, and what's the difference to it going to therapy in Europe. I don't really think you can say there's a huge difference. I mean, I grew up in Germany, in a big city, so it was a very still normal thing to go to therapy, and when you need help, you would get it. We would have a school counselor, and then when I went to study in Greece, of course I was studying psychology, so I always felt it was a bubble in which we already were supposed to be the creme de la creme from the open-minded people regarding therapy, and then there I was sitting in a classroom full of girls, and some of them saying, oh no, I would never go to therapy, I just want to be a therapist for somebody else. And I was like, wow, so it doesn't really matter where you are or which age you're talking to. I just really realized when you start talking about it, most of the people will open up so much more and tell you so much more about that they have been to therapy, or a friend of them, or their family. And maybe I think this is the most important thing in the end, to just talk about it as it would be something normal, because it is. And maybe coming back to what Jordyn also said on the diabetes, for example, of course, this would be an example you can't see, but obviously somebody put as crazy or something that we just can't see, and that's why we don't understand it. That would be maybe something more to think about in terms of how to normalize, and maybe also bring this conversation more into education, and like as much as possible out there to make it be talked about, to I mean, if it would be on me, I would send everybody to therapy just for a few sessions to realize how important it is and how helpful it is and how much growth there's out there. And yeah.
Yeah, I think that, so sorry, did I interrupt you? I maybe I just heard an echo.
No,
I didn't.
no.
Okay, great. Also, I think maybe something happened with Marina's internet, so hopefully she'll pop back in here within the next minute. But what you just said brought two things really to my mind. The first one being how it's so important at the individual level for each of us to kind of, you know, be those ambassadors for the destigmatization of mental health and going to therapy, and for each of us to kind of like be those change makers in our own networks of just normalizing talking about going to therapy and normalizing talking about mental health issues and seeking help, and just how that is not something to be ashamed of or to fear. So that was one thing that it really brought to my mind. And the other thing, which is something that I think that Jordyn could also speak to, because if I remember correctly, Jordyn might have also done some research on this, but this idea of how the beliefs of the practitioners and the beliefs of the people in the medical field can actually further stigmatization sometimes, that that doctors and practitioners are not immune to having stigmatizing beliefs, and how that can actually lead to, in some cases, potentially, you know, furthering the issue if they are not themselves being ambassadors of, okay, this is a totally normal thing to do. Like, I'm a therapist, but I also go to therapy because, of course, why wouldn't I, you know, have my psychological health checked as often as my physical health, etc. So Jordyn, I don't know, did you want to maybe like chime in on that?
Sure. So Olga, such important points that you brought up, and we could elaborate on every single thing you said. I'll start here, which is that we know the behaviors of doctors influence how they counsel patients. So for example, doctors who like are really into their own nutrition are more likely to counsel patients about nutrition and weight loss. Doctors who smoke are less likely to counsel patients on smoking cessation. And doctors who value their mental health are more likely to talk to their patients about issues related to mental health. So another layer of that is that I'm thinking about how all of these things operate, not just at the individual level, but at systems level. So doctors historically in the United States are pretty disincentivized, have been disincentivized from talking about their own mental health, because on licensing, when they go to get licensed, they have to, some of the states have questions like, are you currently getting treatment for a mental health disorder or a mental illness? And doctors are scared to answer that question yes, because of the implication that they may be then seen as unfit to see patients and to perform their role. So historically, these cultural sort of systemic factors have dissuaded physicians and other healthcare professionals from taking care of their own mental health and well-being because of fear of being seen as unfit to see patients, which of course only makes the problem worse, right? Anything that's left to be kept underground and suppressed is only going to eventually bubble up to the surface, and doctors who need the help but aren't getting it because of fear are not doing well by themselves or by their patients. So absolutely those things matter, but it's not just about like the individual beliefs, it's also the systems that we're a part of that really drive a lot of the behaviors.
That's so interesting. I wasn't actually aware of that piece regarding like the licensing and the certifications. And I wonder what that is like in like the Greek context. I'm not actually familiar with what that process looks like. Olga, are you by chance familiar with that from your studies at the university? Like if they ask about mental health questions during like the licensing or certification or qualification process in the Greek context?
So as far as I'm concerned, after the 4 years psychology diploma, you can graduate from in Greece. You get your psychologist certificate, which allows you to practice counseling and open up your own office, let's say. There you don't get asked anything about that. Then further up on doing therapy practice and your master's, I can't really tell because I haven't done that. I don't know exactly. I can't imagine that it would be a reason to not allow somebody to practice therapy with clients or patients. But yeah, I personally think it's such a blessing to also know the other side by sitting on the chair of the doctor or the therapist, the counselor.
Yeah, absolutely. Absolutely. Yeah, I think that it's kind of shocking to hear that, like, in the United States context, that, you know, doctors can be penalized for seeking therapy, because it seems like they should, on the contrary, be encouraged to, you know, really take care of their psychological health. So I hope that, you know, things are a little less stigmatized systemically in the Greek context. That would be interesting for us to look into further, but it's good to know that as far as like the qualification with the psychology degree, that's not a question that people are asked. That's very encouraging, I think. So great. Thank you so much for answering my questions. I'm going to turn it over to Marina now to ask the next one.
Yes, I'm going to dive into a very familiar topic, COVID-19. So the COVID-19 pandemic and the resulting economic recession, of course, have negatively affected many people's mental health, and of course created new barriers for people who are already suffering from mental illness or other disorders. So I heard that during the pandemic, about 4 out of 10 adults, something like this in the US, have reported symptoms of anxiety or depressive disorder. And this is a huge number if we consider as a percentage. And my question is it normalized to talk about mental health issues due to COVID-19? Has the pandemic accelerated the education for mental health? Olga, do you want to start, if you don't mind?
Sure. So in my view, to answer to your last question, it has accelerated conversations and discussions on that. I keep speaking, and since the beginning of the pandemic, everywhere is so much more posts and trying to raise awareness from several, like, social media, any kind of social media, just trying to normalize the situation, because of course this 4 out of 10 for me sounds very unrealistic, to be honest. I think it might be the double, like from what I've heard and what I've talked to acquaintances and family and friends. It's like at least 8 out of 10 who are experiencing anxiety or any symptoms of fatigue and difficulties in concentration, loneliness, etc. I think we saw all a little more clearly how fast people who were fine before suddenly show symptoms and do not feel well, and how much, of course, everybody who was already having challenges before, may that be social challenges or financial ones, like have had such a more even difficult time to cope during the past months. So yeah, I see a very huge opportunity in all of this happening. People talking more about it, people talking a little more openly about it, but at the same time, we just see that the resources are not there, and they definitely have not been growing in the last months, even though there was, I think, a 70% more of an increase of people reaching out for help.
Yeah. Can you tell us a few, let's say, tips in order to reduce COVID stress and promote well-being? Do you have, 5-10 tips, let's say,
Yeah,
for people
sure.
who lost their jobs? for people who feel overwhelmed at home? I don't know, meditation, something like that.
Yeah, yeah, of course. I mean, there are those typical mainstream one, I'll say, you see on a lot of web pages and social media posts. I always go back to that because, of course, our time on social media has, I guess, yeah, gone a lot bigger for everyone. So we see most of the tips we get there. There are, of course, the basic ones, just trying to stick with your daily life routine, get enough sleep and good sleep. Also, watch out about your nutrition, try to eat healthy and not, get used to other patterns which might just drag you down. I think physical activity is a very important point, which of course is difficult right now for a lot of people who are still supposed to be inside. And all of this motivation to meet up and do sports or other activities which are strengthening body and mind, of course, are difficult right now. So they fall away basically. And yeah, so these were the mainstream ones, I guess. And what I would say, what maybe has also helped me, or I've seen that has helped people, is of course what you mentioned, meditation. Even for people who had never been in touch with the meditation sphere, there are so many good apps like Headspace, Smiling Mind, Seven Mind. I don't know. I could tell you a whole bunch of lists I've downloaded, and just try it out for 3 minutes, for 2 minutes. I've just downloaded the Wim Hof Method. He has a very known breathwork practice, which you can also download on your phone. It's just 3 minutes per day. And when I, for example, get very anxious about studying, this is something which helps me a lot in the last time. Then everything which comes out of the positive psychology corner, which I don't want to take away from Jordyn's tips, but I'm a very huge fan, of course, of gratefulness exercises, trying to get into flow situations. Might that be just, I don't know, reading, painting, doing something that you really just used to do as a kid. I think a lot of people had the chance to rediscover hobbies with so much of like plenty of time we've had in the past months. And also definitely, if you have the chance, go out every day for a little walk, even 10 minutes. I mean, it's difficult, and with the time it's getting even more difficult, but this contact, like me personally, this might sound a little crazy, but I've started hugging trees because this it might sound like I have friends and they're just laughing about me on that, but this connection with nature is, it is so incredibly important. It is the most mindful thing that you can do in the fastest of time. And just remember that it's gonna pass. It will pass, and we will learn, and we will strengthen our resilience, and we will learn out of this. And yeah, I mean, if I would have had to prepare a little tips list, probably it would be a little more concise and I would have more. But if I think of something else, I will maybe tell you later. So that's for the beginning.
Your tips were very, very insightful. Thank you. Jordyn, can you tell us if the pandemic, in your view, has accelerated the education for mental health, and if it's normalized to talk about mental health issues due to COVID-19?
So I completely agree with everything Olga has said. I do think this is one of the positive things that will strengthen our collective resilience, is that we are talking about these things more. And we're realizing this is really the first thing we're experiencing as a global community that is affecting everyone. Of course, everyone's impacted in very different ways, and we're sort of all in our own boats, but riding these waters together. And I think there's so much power in that. And going back to an earlier point of just like we have role models who are talking about this, like really esteemed people in society and in our micro communities who are admitting that they're struggling too. And I think that's what it takes to normalize these conversations, is to be role models and to have role models who are vulnerable and talking about these things. And, you know, it's really, I mean, a lot of people are struggling really hard right now. But as Olga said, I think a big bottleneck is that we don't have more mental health providers to accommodate the growing population of people who are reaching out for help. So there's a rise in psychotherapy apps, so like texting-based psychotherapies, which is exciting. I'm not exactly sure what the data is saying about them, but I think like having a human being to talk to and to just listen to you, even if it's not to problem solve, just having someone to listen is so critically important. And for people who don't have another person or a friend or an online therapist to listen, they can listen, you know, keeping a journal and just getting your thoughts out on a piece of paper can be really therapeutic for people, because sometimes it's just when it's all up here and the thoughts and the ruminations are happening in our own heads, and just naming the feelings, whether it's on paper or speaking it out loud to a friend, that can just be so helpful and settling to the mind, to the body, to say, okay, like I got this out there, and now I've named it. I've named my demon or my beast, and now it's out there. So practices like that can be accessible to anyone, and they don't cost any money to write down our thoughts. But I do think it is increasing in just being something that's normalized right now, and we can't stop here. And I think we need to really ride on this momentum to make sure that, you know, even, I don't think the pandemic's going anywhere so soon, but even when it's over, that we are still talking about these things and not just saying, oh, okay, like pandemic's over, we all feel good, because I think the effects of this are going to be pretty long lasting.
Sure. What you said about the writing, you know, writing your thoughts down was really touched me, because I also did that during this period, and before that, because I'm more of a writing person, let's say. So I think if I would ask you to say one tip, like I said, Olga, to mention one tip, is to write down our thoughts, right? That helps. Yeah.
I think it can be very helpful. And then writing down our thoughts, and then the positive psychology spin on that, which Olga alluded to, is then writing down something we're grateful for, and leaning into this idea of ambivalence. Like, I can be really anxious about this situation and have a lot of negative feelings and need to get them out, while also feeling incredibly grateful for my life, incredibly grateful for this moment that we have, having hope that things are going to get better. So, you know, honoring this yes and, that I can feel pretty dismal about some things, and at the same time have some hope that is over, you know, can shine through as well. And I think so in a journaling practice, and the same goes for therapy. Like, yes, venting is important, getting out the negative thoughts, and also deliberately finding a sense of meaning, a sense of gratitude, hope is, I think, also quite important.
Yep. Thanks so much. I'm giving the floor to my colleague Emily, who will want to ask more questions.
Thank you, Marina. Yes, so I think what I'm really curious about discussing now is kind of this question of like, okay, we see that people that we know are everybody basically is we're all struggling, we're all going through this situation together, and so it's like, you know, a certain level of distress or discomfort or anxiety, I think we've kind of all come to accept is pretty normal when you're dealing with a global pandemic. So I guess the question is then, how do you know when it's time to really say, okay, I need to like seek professional help? Like, how would you notice that in yourself, or how would you notice that in others, to say, okay, this person really needs like extra mental health support. Like, I'm going to suggest for them to see a clinician? What's the cutoff, or what are the signs, I guess I would say, that it's not just, the normal run-of-the-mill pandemic anxiety, but it's actually something more? Maybe Jordyn, do you want to speak to this first?
Yeah, so I think huge things are, I can think to the DSM criteria for major depressive disorder. The two big symptoms we screen for are over the last 2 weeks, like how often have you been bothered by feeling little interest or pleasure in doing the things that used to give you interest or pleasure? So for example, if you used to love going outside and getting a run in and calling up a friend, and you no longer feel joy from those things, that might be a sign that you are experiencing some depression. Or if you just have a depressed mood and are feeling sad pretty much constantly, or more than half the days for the last couple of weeks, that's a sign that you may be experiencing some depression. And all of this is in the context of life is a little bit monotonous right now, and it's hard to experience joy because we can't do so much. Then anxiety, are you like worrying a lot about a lot of different things? Maybe that may be out of proportion to the genuine risk that is being posed. Or are you worried so much that you feel stuck and stifled and can't move forward and do the things that you need to do to function in your life? And those are sort of like the 4 screening questions that we do for all of the patients that I see every time I see them, for depression and anxiety. I think if people are feeling suicidal, having thoughts that they would be better off dead or didn't want to wake up in the morning, but it's more of like I'm just thinking about this, I wouldn't actually act on it, that is a signal that you would definitely benefit from talking to someone and seeking professional help. And if you have any active thoughts of suicide, I want to end my life, and this is how I'm going to do it, and I want to do it soon. I highly recommend that you go to the nearest emergency department as soon as you're feeling this way to get safety, and make sure that you are with people and not alone, because of course, that is the worst thing that could happen, would be that someone take their own life due to these symptoms. So that's sort of like a very clinical response, but that's what I would say. And tell someone, don't keep these feelings to yourself, because this should not be anyone's burden alone. The most important thing that we could do is reach out to someone for help when we need it.
Yes, I think that is that's so true. This idea that like no one should have to experience something alone, and that just like reaching out can be really like the most important first step. So thanks so much for that comment. And Olga, I want to ask you a slightly different question that's kind of related to something that you were speaking about earlier, about how people are kind of relating with one another and being in contact with one another now through social media and this virtual space. And just wondering if you think, because you had mentioned that that's a way that now people are actually getting more mental health information, because people are now like talking about it in the digital media, or the social media space. But I'm wondering if you think that there are any like negative impacts as well, or what this kind of, relating to one another and socializing on the virtual space means in regards to mental health.
Yeah, very huge topic. Now, I was actually already preparing the answer to my mind to the previous question, but I'm just going to add it towards the end. So, of course, social media has a lot to offer. May that be that you just are able to talk with your closest friends and your closest people at any time. You can even, of course, see them over video, talk to them on the phone, which is giving so much more than not having the chance to have contact at all. And at the same time, it's 24/7. You basically don't have to feel alone ever But of course, the dark side and the other side of the moon is that this is actually hindering the communication we actually need in order not to feel alone. So we have a lot of studies which show that we basically don't spend so much time anymore in person with our friends that people did 20 years ago, because we know we will always be able to be in touch with them even through our phones, or that there's even a term which I don't remember right now, that people stopped calling. They just they're just texting. And I remember reading an article about this, about Asian countries, and then the other, I think it was in summer, when a friend of mine, like, he was like, "Oh, why are you calling? You can just text me." And I was like, no, this is this is so sad. This is so, like, unhealthy, but we maybe just don't realize, because we think the other thing, the texting might be faster or easier, but in the end, it's actually really stealing all those very, very crucial and important parts and characteristics of communication. We need to feel close to others, seeing the other, touching the other, which of course now in the lockdown situation is not always possible. But yeah, I just really hope we won't realize when it's already too late. And what else? I mean, we know, of course, that what I said before about all the tips Marina asked me in the list for regarding sleep and nutrition hygiene, like how important it is to be away from technical devices while eating or before going to sleep, and how much they really influence us in our brain activity and in how we react as organisms biologically. Yeah, so these might be just like two out of the points I'd like to raise on that issue. And just to add on what Jordyn was saying before, on how you can really realize when you need help or not, the most general answer I think would be whenever you feel like you're not doing well, whenever you feel like something isn't functioning, may that be in your relationships, in your job, and how you feel with yourself. But at the same time, what I've been seeing while speaking to friends is that I don't know whether this is also a belief very stuck in today's world, but this probably belongs to all that. Don't be weak, just go ahead. You can do it. Like, you have to be the best. You have to be everywhere. We don't allow ourselves the help and the realization, the awareness about what we actually really need. And instead of maybe considering therapy when all red flags are already up there, I think it would be very, very crucial to learn what orange and maybe even slightly yellow flags are in our thoughts or in our behaviors, to realize and better go a lot earlier than too late and ask for help. And yeah, an example could be that, of course, we might don't know what these yellow flags are. So what Jordyn also mentioned before regarding the active suicidal thoughts of, okay, I really don't like my life, I would like to stop living. Or also all those passive suicidal thoughts, we might not even realize they are passive suicidal thoughts. Like, okay, if I would die tomorrow, let's say, who would even realize? Or how many people would come to my funeral? I've heard people saying that, and I was shocked, and I was like, maybe we just don't realize. I also have had thoughts, and then in therapy later I realized, that comes from this dark corner. So, well, I didn't know. And then when you realize, okay, I could have asked for help so much earlier, and so many things would have been easier. So probably this also all starts on talking about it. So if you see any mental health posts on Instagram, repost them.
I just want to jump in because I think just to underscore so much of what Olga just said, that these like orange flags and yellow flags, like other signs, like when you feel yourself withdrawing from other people and, you know, oh, it's just not worth talking about this. I feel like such a burden on them. Those are the times when we have to, it's like be even more effortful in speaking up and advocating. I'm drinking a little more. I'm, you know, doing a little more drugs than I, you know, would like to be doing. These are all signs when it's harder than ever to reach out. That's what's so tricky about mental health. It's not obvious to other people necessarily because it's not super visible. And what Olga said about this, just like this culture where it's like, okay, I'll suck it up. One tool that I really like to offer to my friends is try to imagine that you're your own best friend. Like, what advice would you give your best friend or your sibling, someone you love, going through what you are going through? And that's where journaling can be really helpful. So often we're way harsher with ourselves than we are with other people. And what we really need to give ourselves is that love that we would so easily give to someone else, but it's so hard to turn into ourselves.
Yeah, very, very important.
That's very, very important things that you're both speaking about from the you know, clinical side, but also just from the sort of like emotional side of like, okay, this is what a doctor would say as far as when you need to go to see somebody, but this is what it feels like whenever you should start thinking about going to see somebody. So thank you both for those thoughts. And I just want to be aware of time. Marina has one more question for you both. So maybe you can try and keep your response to just a minute, just for this last question. And I know that we're kind of putting you on the spot with this one. But yeah, I'll turn it over to Marina now.
Thank you, Emily. So my question is about the public health and public hospitals in general. We know that the public health, there are many challenges confronting the public hospitals. That these are infrastructure, maybe deficient manpower, patient load, quality of services. So, but again, a lot of people prefer this kind of service, let's say, in order to save themselves because they don't have more money to go to a private one. And the question is, what role can or should the government or public sector, public hospitals in general, play in these issues of mental health and mental health support access? We know the problems. The thing is, what can we do in order to see some kind of improvement? What can they do? Maybe Olga, can you start by answering this question?
Yes, of course. Okay, so what it's difficult for me to start and keep it short now, but yeah, maybe just in 2 lines. What I really think is a total no-go in the world we still live in, that we have to pay for counseling and therapy, even though it is such a crucial, basic right for health. And as we go to the doctors, we should be able to also go to therapy and not have to wait 1, 2, or even up to 3 or 4 months right now, because of how much the rates like got higher in this pandemic. And I'm constantly trying to compare like health systems from what I've seen. For example, in Germany, you can have free mental health aid, like therapy and everything. In Greece, it's a little more difficult. Like most people have to pay, and of course, they do not have the money to pay for it. In Spain, it's the same. So there have to be more offices of public mental health support, more therapists that are paid by the state. I mean, only in Germany, we know that 3,500, I think it was, public like therapy offices are missing. But I can't even imagine how much more it would be in other countries where there's so much need and there's just no resource. So in order to get back to your question, what we should do is definitely try to raise awareness on those issues, also on political level, and remind our health systems that this is where we really, really, really need to put more effort in, and maybe somehow restructure how financial aids flow in today's political societies, and I mean in Europe, and I guess also in the US. Maybe I just can give it further to Jordyn.
Yes.
Yeah,
Right. Jordyn, can you answer it?
Sure. Super big question. I'll add just two thoughts. One is the utilization of community health workers in the mental health space. We know training members of the community to serve as facilitators to create spaces, not even only individual one-on-one therapy, but groups that can come talk and meet in community centers, outside, in places where they can just continue normalizing in a really big way these conversations. So there could be, we know Alcoholics Anonymous is a great resource for people with alcohol use disorder and other addictions, where we bring people together to talk about these things in a group setting. So groups like that explicitly around topics of mental health within existing communities that could be funded and sponsored by governments. And then I also think that we need to remember to take care of the healthcare workers too, that there could be a huge role from governments in really caring for the caregivers, because and healing the healers, because the therapists and the quality of therapy is only going to be as good as who those individuals are and who's investing in them. So making sure that there is, adequate care for the people on the front lines, giving mental health care to others. Every therapist should have their own therapist. And of course, in the short term, scaling that up is very resource intensive, but in the long term, you have less turnover, greater job satisfaction. People can actually stay in the profession to support more patients. So I think I agree with everything Olga said, and then those two additional caveats as well.
Thank you for your enlightening comments. It's very helpful.
Yes, extremely, extremely helpful. And yeah, so that was actually our final question. So I just want to take one more opportunity to thank you both so much for being here, Jordyn and Olga. I think I speak for both Marina and myself that we really, really enjoyed this conversation and have learned so much. So thank you again for joining us today. And we hope that you enjoy the rest of your evening or afternoon, I guess. So thanks, everybody.
Thank you, both of you. Bye-bye.
Thank you very much. Take care.
Take care.